Thank you so much. This is a huge honor, and on behalf of our board of directors and all of our staff, we're profoundly grateful. When I first moved here in 1991 as a graduate student and employee, Pastor Jean Cramer-Heuerman is one of the first progressive, justice-loving people that I learned about in this community, and I felt that I had come to the right place. So this is a huge honor. Thank you. I want to tell you a little bit about our organization and the work that we do. So we do direct service to individuals. All of our services are free. We have expanded them over the years. I started at Healthcare Consumers in 1997, became director in 1999, and I've been there for 28 years. And I count my lucky stars that I landed in such a wonderful organization. So we do direct service, and I'll describe that in a moment. We also do advocacy and community organizing. And we are now in a time when we have to do a lot of community organizing because things at the federal level are terrible. People will get hurt if we don't find ways to try to stop some of the policy changes that are happening. But our direct services include, well, you already heard about some of them, but we help people get access to health insurance, all kinds of health insurance. We help low-income Medicare beneficiaries get access to Medicare Savings Program and Medicare Extra Help Program. And we also help people apply for food stamps. And we have a fund where we can help cover the cost of prescription drugs when people cannot afford those prescription drugs themselves. And we also, one of our newer programs that I'm really, really proud of is our Disability Application Services Program. We now have a team of 3 staff members who are helping community members apply for disability. If anybody has been through that, you know how incredibly difficult it is. Right now, the Social Security Administration is understaffed, and so it can take months or even years for somebody to get approved for Social Security disability. And the Trump administration is proposing to cut Social Security Administration staff by half. So this is a huge concern. And a lot of times people who are applying for disability have no income in the meantime. So when they come to us, they come seeking the services of applying for disability. But so many times we have to jump in and kind of help create a foundation under the people to make sure that they have resources so that they can survive until they get approved for disability. And some of those resources can be helping people get township general assistance, or helping them get rental assistance, or helping them get housed if they're homeless. A lot of these individuals, if they are not yet homeless, they are very much at risk. And so a lot of the work that we do is sort of ancillary work just to help support the person as we're going through the disability application process. And in my estimation, we have 3 staff right now doing that work. This community needs about 10 or 12 staff because that's how great the need is out there. Our direct services also help inform our advocacy because we see firsthand how policies from local institutions or from the state or the federal government play out in people's lives. We see the changes that need to be made. We were so grateful when the Affordable Care Act was finally passed because in the state of Illinois, Illinois expanded the Medicaid program to cover even more people. And so the rates of uninsured individuals in Champaign County are actually pretty low now thanks to these policy changes. So we see, where things can be improved, we see what's needed, and then we advocate and organize for those things. I want to talk for just a moment about something else that we're doing that I'm really, really proud of and really excited for, and actually one of the members of your congregation here, Ashlyn Stillwell, is also involved in this work. We are creating Hope Village. Hope Village is a tiny homes village for individuals who have been experiencing chronic homelessness and who are medically fragile. And it will have 30 tiny homes. They're small, but they're fully equipped, one-bedroom homes, full bathroom, full kitchen, and they're going to be designed, or they are designed, to age in place. And these will be permanent supportive housing for individuals who need this. Right now, there are homeless individuals who are terminally ill, who need ongoing health care, and we're staying at a shelter is not a viable option for them. And also, it's hard to find fully accessible housing for people in our community. So the homes will also be very sustainable, and they're designed for energy efficiency, and that's what Ashland Stillwell is actually working on. And we will have an on-site community center with on-site case management staff, healthcare access, and different programming and gardening and things like that. So I'm very excited about that. Construction should start this spring, and then hopefully people can start moving in early next year. And that came about because of seeing how our housing system in our community is not meeting the needs of some of the most vulnerable people among the homeless population. And then in terms of advocacy and organizing, we are gearing up because a lot of changes are coming. A lot of proposals are being made that will hurt a huge number of people in this country. There are proposals to cut Medicaid funding and basically do away with a lot of public health, just at a time when Ebola is on the rise, chicken pox are on the rise. There's a measles outbreak in, Texas and New Mexico, and it'll be spreading. And so we have a lot of work to do to engage community members and get them involved in activism. And this isn't about partisan politics. We're not allowed to be involved in partisan politics. But it is about right and wrong. And it is about how policies made at the federal level can harm people at the local level. And so you will see us ramp up for that kind of community organizing. And for people who are interested in getting involved in that, you can visit our website. You can just Google Champaign County Healthcare Consumers and find our website, and there's a section about get involved, and you can get signed up for our email, and that's where we issue action alerts. And then you can also share those emails with other people. People in our community are hungry for something to do because they see the changes that are being proposed, the changes that are happening already, and it is frightening. And so activism, I think, is our only hope. It'll carry the day. But activism, I love the scripture readings for today because I feel like that kind of activism, a lot of times it's motivated by anger, which is good. Anger can be a fuel for action. But beneath that anger, there needs to be love for people and love for justice. And that needs to be the true motivation for action. And I think together with that kind of motivation and those actions, that is the hope for this nation and for the people whom we want to protect and serve. So again, I see the clock. I want to be mindful of time, but I just wanted to say thank you so very much for this award, and I hope that we can all work together to try to protect the people of this nation, the people of this community, and certainly those who are the least among us. Thank you.